But I do feel that the HSE has enabled women like myself and like Una to take on some of these difficult roles and do it with a young family. And I think that's something that really should be celebrated.
Hello and welcome to the HSE's Talking Health and Wellbeing podcast. I'm Noreen Turley, and for International Women's Day 2026, we're taking a little time to spotlight the women across our health service. We're using this moment to celebrate the fact that 78% of our HSE workforce are women who are powering forward, showing up every day and keeping the services going, especially our frontline staff. We all know that staff in our health service do work under real pressure every day. So this episode isn't about adding anything extra to anybody's to-do list. It's about recognising what's going well, acknowledging the reality of juggling work and home life for women, and reminding people that supports are there if you need them. We're focusing on women's experiences today because so many women in the HSE are balancing paid caring roles at work with unpaid caring roles at home. But everything we're talking about, whether it's honest conversation with your colleagues, flexible working hours, or the Employee Assistance Programme, applies to all staff, regardless of gender or grade. So I'm really delighted today to be joined by two women who've both had incredible journeys in the health service. Una Rogers started out as a staff midwife and is now National Nursing Midwifery Innovation Fellow and Midwifery Officer with the Department of Health. And Gillian Ledwidge Dunne, who began her career in the HSE as a grade 4 and is now Regional Director of People for the HSE, Dublin and North East. So thank you very much for joining me today.
Thanks, Noreen.
Okay, so Una, we're going to start with you because, as I said there, you started off as a staff midwife and you've worked very hard to get to your position. So let's take you back to really what it's like working on the front line and how difficult it is. You know, in those early years when you're working shifts and maybe you're having small children or you're trying to balance all those daily things that you have to do as a young woman.
Yeah, when I think back to those days, it's a mixed blend of nostalgia, but also a bit of sadness. I kind of get emotional when I think about it too. They were some of the best days of my career, the friendships you make on the front line, the night shifts. But then also as life progresses on and relationships form and you start to have a family or, you know, more priorities come on in life, the scales always start to slip and you kind of lose sight of yourself. I had my children young. I was 26 when I had my first and we were getting married and I was full-time. We were trying to buy a house about 10 years ago and there was no opportunity for me to cut my hours. I needed to stay at the 39 hours. My husband was a teacher, both public servants. We were fine financially, but there was no option for me to go part-time. And then the babies came along and first of all, my maternity leave needed to just be the 6 to 7 months. I couldn't take anything unpaid and that was fine at the time. But looking back on that, you kind of have a sense of regret that you had to go straight back into it. And I was back on night shifts within about 4 weeks because we were in a staffing crisis and I was working on the labour ward at the time. And before my children, I loved doing night shifts. After children, that became very difficult. If I was working 4 nights in a row because we had a shift pattern, I essentially didn't see my kids for 5 days. And my husband really had to take the slack and we were living away from family. It was all just on us. And you get to a point where you have to decide, am I going to be a good employee, a good wife, a good mother, or a good friend? Because you cannot be all 4. And that ebbs and flows, you know, depending on tiredness levels, what's going on at work, milestones with the family, relationships with friends. So I found myself just naturally, you know, you're not doing this consciously, you're just naturally being a really good friend for a while. And then the friendships disappear for a couple of months. You are naturally being a very good wife for a while, and then that slips. But in your head, as a mother, you're just constantly living in this cloud of guilt. Am I a good mother? Am I a good mother? Am I a good mother? So yeah, I think back on that and sadness now, but also reflecting that it made me who I was today. It definitely built resilience. Even though my marriage at times would have struggled with having to be on shift work and being gone. And when I would come off shift work, being just so relentlessly tired that I don't know if I was good to anybody. Now, since my kids are much older, those hard years have definitely strengthened the marriage, you know. So let's not sugarcoat it. It's a tough time, but it's a moment in time.
Yeah, no, I think that's so important. And it does make me nostalgic as well when I think back to the early years as well. of working full time and having kids and stuff. Gillian, if I ask you, do you think that's us women, we do try and be it all? Like Una pointed out there, we're trying the friend, the wife, the mother, the sister, the everything. And it is difficult to get the balance, isn't it?
Absolutely. And mom guilt. I think I say that expression multiple times a week to multiple different people because it's alive and strong. And I think that's a real fundamentally a female thing, that we do get mom guilt. It is hard to be everything to everyone. And I think certainly for me, and I think certainly from what you're saying, Una, sometimes we give to ourselves last, and that can be really difficult. And you do get to a point where maybe you're running on empty. You need to find time to carve out some time for yourself. But it's interesting, Una, you talk about the support from your husband. And I too, very lucky to have a very supportive husband. But I'd also credit, there's a lot of people involved in our lives that have been hugely influential and supportive of us. As I say, it takes a village, and it really does. And I'm very lucky to have parents that live very close to me. And I know you referenced that you didn't have that. And I think that for me, I don't know how I would have done the early years without having my mum and dad so close by, and my mother-in-law as well is close by. So I don't know how you did it.
Yeah.
Well done, you.
I don't either, Gillian. Yeah.
And Una, really, I didn't have that either when I started out. And I wasn't nursing at the time, but I actually took a career break. So I'm nostalgic for those times prior to that. But then also, it's about what's right in your life at that particular time, I guess. And it was great that I was in the HSE able to do that, to take that career break. And we do have supports for people, I guess, within the HSE, even though it is very difficult. And we come home, all of us come home and do the second shift. And it's not just for people, I suppose, who have kids. It's people maybe looking after. You're the carer during the day, and then you come home and you're looking after parents now. At my age, that's a lot of my friends are looking after their parents. There's different difficulties, hospital appointments and stuff like that. It is difficult as a woman. And I think we take on so much. And Gillian, like you said, carving out the self-care. When you're so busy, it's really hard, isn't it?
It is such a challenge. You'd love to have more time. I do my best. I love Pilates and gym and working out. And for me, it's getting up before the kids wake up in the morning and trying to carve out that little bit of time for myself. But that's a challenge.
Yes.
And it doesn't happen all the time. I'm great at starting. I'll be brilliant for 6 weeks, like all of us, I think. And then it just kind of disappears. But at the same time, I think it's having those connections and having other moms, I think, to talk to.
Yeah.
And that can be socially in your personal life, and it can also be in your working life. I'm someone who, through my career, I feel like I've received a lot of support from managers over the years and colleagues. And I try very hard to pay that forward.
Yeah.
Now that I'm in a very senior managerial position with a large team, I try very hard to be understanding and to not make people feel that they have to come in and make an excuse to me that I need to be at something, because I regularly say to my team, life happens and that's okay. And I try hard to support people in that journey because I know how hard it is. In particular, when you reflect back on those early years, Una, you're dead right. There's mixed emotions. It is such a hard time when you're running on empty. You've no sleep.
Kids are constantly sick.
Constantly sick.
Yeah.
Croup. Oh my God, croup. If there was croup one more time in my house,
I know.
So I totally understand where you're coming from. You look back, you got through it. I'm not sure what age your children are. Mine are like 11 and 8.
Yeah, close. Yeah,
close.
9 and 6. So yeah, it's a good time.
You know, I feel like I've come through to the other side now. But I say to all my friends who've kids maybe a little younger than mine that every phase presents a different challenge.
It does. It does. And Una, if you were to look back and give advice to people starting off in that situation, what would be the main piece of advice?
I remember watching a meme once of Tom Hanks, and he said, "This too shall pass." That's the best advice I can give you, because when you're in the trenches of it, you can give practical tips and whatnot, but it's very individual. But just to remember, and my mother said it to me when the babies were very small and we were moving from slap cheek to some other weird virus, this too shall pass. You will get over this hurdle. But to come back to what Gillian was saying about self-care, I've had a journey with self-care over the last 15 years. And I'm smirking to myself now because I know when my husband listens to this, he's going to laugh out loud. So right now I run. I'm training for a half marathon. I love the gym. I love doing Pilates. But I was not that person when I was 25, when I should have been healthy. It would have been much easier to run 10K back then. I'm mad at my 26-year-old self for not doing it. But I was not in the mind frame for that type of self-care. So it's tokenistic to just say to people, get out and go for a walk. That's self-care. Really, for me, at that time, when I was moving from shift work pattern, nights, weekends, missing Christmas, working every bank holiday because I needed the overtime.
Money. Yeah,
and you're balancing needing the shift and not wanting to work the shift. And I did every different type of pattern. I used to cluster them together to think I'd get them over and done with and then have more time off. And then I would come and be some form of a zombie. I tried everything. I was not exercising. I was not eating healthy, and weight was an issue. Energy levels were an issue. And for me, self-care at that time was sleeping when I needed to sleep, knowing that if the day was a couch day with the kids, that's okay. Trying so hard to not have guilt to say, oh, I didn't get them out to the park today. Because just knowing that you were there with them, they had their mom for the day, that was all they needed. And I had these unrealistic expectations of what I needed to do on my days off. And my husband is so supportive. He wasn't coming home going, why are the dishes not washed? He wasn't. But I was going, the dishes weren't washed because X, Y, Z.
Yeah.
So self-care at that time was survival instincts. I'm talking about it quite negatively now, but it didn't feel like that back then. It just felt tiring and draining. But that moment passed. And now, like Gillian, I'm in a different phase of life now where the kids keep me busy, not with sleepless nights, but with soccer matches and training and play dates. And 2 of them had a sleepover last night. They were awake till 2 a.m. So it's a different journey now. But self-care now is exercise, prioritizing myself, making sure that I'm a healthy version so that I can have the longevity to be with my kids when they become adults. That's what I know is important now. But it wasn't important 10 years ago.
I know. And one of the things I remember is trying to be it all. And if I could talk to my younger self, it would be just reach out and be honest about how you're feeling and stop trying to put on this face. You said, Gillian, there, that with your own staff now, you try and life happens. And there are supports that we do provide in the HSE for people as well, if they're finding things difficult. And you don't have to be in crisis.
No, we're our own worst critics. You're mirroring all the thoughts that go through my head. And in a way, isn't it great that we're talking about this, because it's really reassuring that it is okay to have a day. And I'm exactly like you, Una. When I'm at home and I've downtime, I feel I should be doing something. The washing should be done or something should be done. And actually, it's okay to have a day off and to switch off and to do nothing. But we nearly have to be okay with that ourselves as opposed to convincing anybody else. And I do feel my husband doesn't suffer from that, in the sense that I don't think men, they think a little bit differently to us. And actually, we probably should be more like them, in the sense that he'd say, sure, it doesn't matter if it's not done. It's okay. We'll do it later. Let's go and have fun with the kids instead. And it's just a different mindset. But I do think we're our own worst critics. I would feel in that work context, Noreen, I think it's about building trust.
Yes.
And I think that's really important. It sounds so simple, but it can be very difficult to be vulnerable and expose yourself a little bit to somebody and say, it's hard for me at home. I'm struggling at the moment. It's difficult. I have 15 competing priorities and yet I'm in work for a break, And actually I get to drink a cup of coffee warm. And that's, I totally understand that. I get that. I do think that trust with not just your manager, but maybe your colleagues as well. People can come in and support you. I think that's fundamental.
Yeah. And having that culture of trust within that group of people, because you spend so much time at work.
Yeah.
And then very often your manager, they're getting pressures from every side as well, like the middle management or whatever. And they're trying to do their best. I mean, people show up every day in the health service and they really are trying to do their best. And we don't know the demands that everybody else is going through or what their priorities are for that particular day. I was interested in the way that you said, Una, there, that your self-care at that time was if you just needed to spend a couch day with the kids. So it's not all about getting up, running. It's whatever really it takes to get you through the day. And that's enough, maybe for that day, that is enough.
For that moment in time.
For that moment in time,
Maybe it's about just literally picking up the phone and having a rant with your friend for 20 minutes. Or I actually found the coffees after work really invaluable. Even though it was 8 o'clock at night, who wants caffeine at that time? You want to get home, the kids are in bed, you want to see the husband, but you think, I'll take 15 minutes. And they were some of the closest and still my closest friendships now are my colleagues that we just needed to vent for 15 minutes about everything and anything. It wasn't always about the shift. It was about
life
admin that needed to happen. And then that trust, like you said, Gillian, like trusting that, she was going to keep that to her and I was going to keep her secrets. And, that was self-care too. And I didn't know it was self-care at the time.
Yeah, hindsight is a great thing, really, isn't it? If you could talk to your younger self and kind of speak. But, this is typical, like you can't put an old head on young shoulders when you are trying to be it all. I mean, you've started off as a grade 4 in the HSE and you're in a very senior position now. Has there been other supports in the HSE that have helped you apart from, say, your managers? Has there other I know we've got things like our employee assistant program, and there are official things that people can reach out for, isn't there?
Of course there is. And, the EAP, I mean, it's an amazing service. And in my opinion, it's not utilised enough and we should be using it more. That is fundamentally important. But for me, when I reflect back, and yes, I started as a grade 4 in the disability sector in HR and worked my way up through the ranks, the best influences on me have been maybe people who've travelled the path before. In my younger career, I actually reported predominantly to male bosses. They were actually incredibly good at guiding me through that based on their own experience and the experiences of their wives. I've been quite lucky to have had leaders around me that have set a really good example to me. I've also had that at home. My own father was a chief executive of a disability agency in the Section 38 agency in the HSE, and he's been hugely influential to me through my career and always kind of pushing me to say, you can do both. Because I used to go home and say, oh, Dad, I don't know, there's a promotion, I'm not sure.
I know, we doubt ourselves,
it might
don't
be a
we?
stretch too far. And, and he'd say, well, why not? Let's prep, go, apply, make the decision when you get the job, and then we'll see how we can make it work.
Brilliant.
So sometimes you need that. And certainly for me, I feel I'm probably a doubter of myself. You need your champions and you need people to give you a little bit of a push. And I would say that influence from him on me, it's sometimes a bit tough love, but it's like, you're grand, go on, you go.
And Gillian, apart from the EAP, there's also the coaching service.
Yes.
If people I found that incredible. I called up really not sure what I was filling in the form for. And I found that fantastic.
Yeah.
And the coach that I had, I was like going, oh my God, I can't believe I didn't use this before.
I was just smirking when Gillian was mentioning about going for the job applications, and a manager that I've worked for before, he was doing research in HR and what drove people to apply for different jobs, gender. And I don't have any statistics to back this up now, but he was saying that what he found was that if there was 10 criteria on an application form and a man met 6 of them, they'd say, yeah, that's fine, I'll apply for that.
Yes.
But a woman has to meet all 10 in her head before she'll apply for it.
Yeah.
And I just think that's fascinating because, again, we're still limiting our own possibilities.
Yeah.
No one else is doing this to us. It's us doing it. I just love what you just said there about your own father being like, no, just go for it now. Just see what happens. You're not going to lose anything by trying, and we'll figure out the variables later.
Exactly, yeah.
This is not just we're trying to get at the men or anything like that. This is the reality.
And Noreen, it's such a good point. And I have to say, I wouldn't be sitting here in this job if it wasn't for a small few men who've been massively influential in my life. I spoke about my father, but my husband as well. And I know, you've spoken about your husband. My husband's an architect and he has a little bit more flexibility than I would. If it wasn't for that, it wouldn't work at home. So, I'm really grateful.
The other thing that when I was kind of preparing for this, I was thinking, oh my God, we've got 4 regional chief executives and we have a new CEO coming in, Anne O'Connor, which we were excited about. No disrespect to Bernard, he's done an amazing job.
Yeah, fantastic.
But it is so amazing to have Anne O'Connor back. And I think that is just a sign of the times, hopefully. And it is an exciting time for women. But saying all of that, do you think women need to be tougher to get to those positions?
Absolutely, Noreen. And my job's not easy.
Yeah.
It's not easy by any stretch of the imagination. It's tough. It's demanding. I have to have resilience. I think you mentioned resilience already. It can be tough every day. It requires a lot of thinking, a lot of brain power. They're tough roles, but I find it very rewarding.
Yeah.
And I'm somebody who has always been quite driven from a young age. I do feel that within the health service, and I'm lucky to work within our region, I have a boss who's very supportive. And like that, there's that trust. I don't have to pretend that there isn't life happening at home. I can be honest and upfront, and it's safe to be honest and upfront. And I think that's hugely important. So yes, these jobs are hard, but I do feel that the HSE has enabled women like myself and like Una to take on some of these difficult roles and do it with a young family.
Yeah.
And I think that's something that really should be celebrated.
Yeah.
And I look at my EMT and it's majority females. And I think that's wonderful.
Yeah. No, it is. And when you go into leadership and management at a very early age, sometimes you feel like you're not really ready for it. But then when you see the difference you can make and when you can push the boundaries, Una, you were in senior positions early as well.
I was one of the youngest managers in my maternity unit. I think there's a fine line between women being assertive and aggressive. And
yes, that's it.
Women have to nearly navigate that themselves to find out where the lay of the land is. That was tough for me as a young manager. I thought I needed to put the big boots on. I thought I needed to go in heavy because I was very young.
To prove yourself, probably.
And in maternity, it's very male dominated when it comes to the obstetric side of things. So you're trying to advocate for women's health as a woman in a position of leadership, but you're not very senior yet. You're in that middle management, so it's tough. I made a lot of mistakes early on, but thankfully learned from them and had great mentorship at the time, not just from my own management, but from the HR department, saying, okay, that email was maybe a little curt. So let's just look at what the message was supposed to be. Because like Noreen, I know you for a while now, you've always said everyone turns up in the HSE to do a good day's work. None of us are turning up to cause trouble. But when that does happen, when you do send the email that is a bit curt, you reflect, you learn, you grow, you come back. You apologise when you're wrong. That's also a sign of strength and leadership.
Absolutely.
And empathy. And what I have learned now, I've moved through the ranks as well and in my national roles now, I am a stronger leader. I am a better leader when I lead through empathy and when I lead through understanding. So now I'm less of a bark and more of a sit and wait.
I've never seen you bark or heard you bark.
Right, yeah. That's because I'm reformed now.
Growth, personal growth.
Thank you. But I've actually learned that I can get work done better and teams come along with me quicker and I still get the same amount of work done. But I'm actually not as stressed anymore and I don't feel like the bad guy anymore. I feel like I'm on a level playing field with everybody.
Now, you're a lot younger than me and so is Gillian a lot younger than me. And I suppose what I've realised in the latter years is that it's okay to be myself. It's okay to show up as yourself. And people quite like that. And it's okay to be honest and develop those relationships. Like you were saying, Gillian, just be present and to bring the people along with you. And people really respect that. Like you say, Gillian, in your job, the way you can be honest with your own boss and life happens at home. And that's just fantastic that you can do that, that culture is there. The HSE, that's what we're hoping, that we can bring people along and that they feel part of it and that they can contribute. Okay, so Gillian, I know there's something about the HSE blended working policy. Is that about people who can maybe work from home?
Yeah, Noreen, it is. It's a policy to allow, I suppose, what people call it as hybrid working. So people who might want to work 1 or 2 days at home a week and then be office-based for the other days of the week. And look, that's something that has to be discussed between individuals, their line managers. I think it's great that we have this available in the HSE and there's no doubt it makes a difference to people. And when I put my recruitment hat on, blended working, it's something we get asked about a lot in interview processes. Is there an opportunity for blended working? And I think where we can facilitate it, we should facilitate it. But we obviously have to be mindful of the supports and the services that we have to deliver to the population. But I think there's ways for us to embrace it.
We're much more flexible than we used to be, aren't we?
We are.
Gillian, that's a good point because obviously you're in the business of HR and people manager. And when you're talking about recruitment, what other areas would you say, if you were putting your recruitment hat on and you wanted to get people to come in, is there anything else that comes to mind that you would be saying to people, listen, come and join and work in the HSE because we do have a lot of good things.
We've a lot of wonderful things.
Yeah.
Sometimes health service and public sector, it can get a bit negative in that space.
Yeah.
For somebody who's very proud to have worked in the HSE or HSE funded service for 20 years, I am very proud to work for the HSE and there's a huge amount of benefits. Our pension, our security, we've very good terms and conditions of employment in terms of our annual leave, in terms of some of those flexible, you spoke about taking a career break.
Yeah.
That mightn't be that widely available in the private sector. And paid maternity leave, I know in our time it was 6 months paid leave, but that's improved. And that's great. And there's also parents' leave and there's all sorts of parental leave and different options available. I do think there's a lot of benefits to working in the HSE and I don't think we should be shy about promoting them.
Yeah. No, I think that's really true. And, when I did a patient partnership podcast with a wonderful lady, Anne Lawler, and she said, it's our HSE. Wouldn't it be great if everybody in Ireland called it our HSE? And I'm extremely proud to work for the HSE and don't shy away from it at all. And it's been really, really good to me. And I'm proud of the people that I work with every day. And, my colleagues are tired of me saying it on the podcast, but people show up and I have met the most incredible people working throughout the health service who are so passionate and committed to what they do every day. And this podcast, I suppose, does give them an opportunity to explain that and to demonstrate the services that they provide to the public every single day. Okay, now you proud to work for the HSE?
I'm very proud. And I was just reflecting there on, what Gillian was saying, all those offerings. And I definitely wouldn't have been able to get to where I am today if it wasn't for the flexibility that was afforded to me early on in my career. And I said it at the beginning, managers need to recognise that this is a finite time in a person's life. Those hardship years were 5-6 years. And now I've come out the other end and I'm able to engage in academics and other things because I was afforded the time to give to my family through parent leave, through flexible working. There was a time where my son's creche hours changed with
No notice.
And I had a wonderful director of midwifery, was so empathetic to those who had families. I'm so grateful to her because she said, do you know what? Let's trial 6 months of you working from home on a Friday. Let's see what your productivity is like, blah, blah, blah. And after the 6 months came to an end and I could go back to the creche hours, we just returned back. So it's about trust. The health service has to balance. We need people working and getting the job done, but we also need the service supporting the employees. Yeah. And when you have that balance and when you have that trust, it flourishes. And in those 6 months, the productivity of my unit doubled. We got a lot of policies in, we got a lot of innovation done, and I was able to then take that to my next promotional job. I don't know what I would have done actually if I couldn't have. I'm kind of sitting here going, I would have been really, really, really snookered because what was I going to do? The creche times weren't going to change, so I had to change.
And look at the benefits that came. It was a real win-win because you were so productive.
Absolutely.
I remember back in the day when I was a ward manager as well, like that. And, we didn't have all the electronic off-duty systems and stuff. But particularly around Christmas, and when you're nursing, you have to work over Christmas and New Year and somebody has to do it and that's just the way it is. And I used to put the months off duty, say, up on the wall, people's names. People filled in their own off duty because they were so cognizant of their colleagues that they were working with.
Oh, the respect.
It balanced it out.
Yeah.
It
Isn't that lovely,
completely balanced out. And you kind of said, okay, guys, we all need to work. We all need to do one or the other. So let's just go for it. And it was amazing the way it worked. It was very fair.
Respect, isn't it?
It was respect and trust. So it was great. The other thing, like I said, we have the 4 regional chief executives and the new chief executive coming in. And it's going to be very interesting. And it is a lot of change in times in the HSE at the moment and a lot of uncertainty with the regions. But there are other things. We have our menopause policy, don't we?
We do.
We have our diversity. We have the EAP. We have culture. In health and wellbeing, we have a range of supports that are free to people. We have our balance and stress programme. So would you just ask people to reach out, Gillian, and to use those free available resources to help them be the best that they can be?
Absolutely. And I think that, as I said about the EAP, I just think sometimes these things are a little bit underutilised.
So when we say EAP, what is that now?
So it's the Employee Assistance Programme.
Right.
So it's free counselling and advice service for all employees of the HSE. And I know people who've used it and have found it incredibly beneficial. And for people who are going through a crisis, and it can be anything, it doesn't have to be related to work, it can be can be a work issue.
And it's totally confidential.
Totally confidential. And it's a wonderful service. And I know that they have been very helpful to people who have come to me in my capacity of my professional role to tell me just how beneficial. It's a lifeline to some people.
I've used it twice.
Great.
The first time I used it was 3 months after I got married. And it was actually my mother who said to me, "You're not yourself. What's going on?" And I was like, well, money's tight and counselling is expensive. I said it to my friend over a coffee and she said, there's this EAP thing. Didn't know what it was, thought that I had to have a work-related issue to go to it. So just shot off an email and I had an appointment within 2 weeks and I was in for 6 sessions and
brilliant.
She was just wonderful. All we talked about was my life at home and how I was adjusting to everything I said at the beginning. Work, mothering in a different county, trying to do it all, feeling like I was failing at it all. The best thing she said to me at that time was, guilt is an emotion that is useful only when you're not performing. Guilt is a useless emotion when you are performing. And that changed the way I thought about myself. I used the same counsellor again 3 years later and again for another personal family related issue. And this time I only needed 4 sessions. So it's really how you get to dictate what you need. It's up to 6. It can be extended if you're in a crisis, but let's use these services before the crisis comes.
I think people probably would think that has to be a work-related issue, that you're not getting on with your colleagues, but it's a personal.
That's what it's for. And it should be used. And it's great to hear real live examples of it being used. And if we do nothing else from having this chat today, if that message gets out, I think that's
and
great.
And it's confidential, and you're not necessarily going to be speaking to anybody within the HSE.
No.
They're not going to be talking to anybody else. They're not going to say, oh, she's coming into work, we're not sure which way she's going to go today. Like, it's a very, very confidential and safe space for you, which is really good. Una, if you were to look back at your younger self, what bit of advice do you think you would have given yourself?
My advice is to stick with it. Try to balance whatever you can balance. Let go of the variables that you can't control. Stop trying to control everything, Una.
Yes.
Because it doesn't work. And I think, take the wins when they come. Sometimes the wins are that, you paid your car tax on time this year. That was a win for me this month. Everything else, it'll sort itself out. Reach out for the people that you need. And yes, okay, my family weren't immediately in the vicinity, but a phone call away. The EAP, like I had said now, was just invaluable at that time. And I use it as a tonic now. I've used it twice, and I know that if things are just getting a little bit cloudy, I'll just take my tonic and I'll just go back to see my lovely EAP counsellor. And I think that's it. Do the best that you can. Self-care is about being the best version of yourself and not giving just what's left of yourself to everybody.
Yeah. Oh, no, that's very generous of you to share all of that. It's fantastic. And Gillian, if you were to go back, or even to people starting off, or people who are concerned about their jobs or under pressure at the moment that are listening to this, what would you advise them to do?
I've had a huge amount of support. I'm very, very lucky, and I know I am, and I really appreciate all those people in my life. And I try to give back to them now. I'm somebody who catastrophizes in my head. And that's something that I'll look calm and confident and present myself well, but I'm one of those people in the background who's questioning my decisions, wondering if I've done the right thing, overthinking, lying awake at night, worrying. And my younger years, I just wish I hadn't wasted so much time worrying about things that actually didn't really matter. And if there's anything that I could say to somebody going through that now, is just stop being so hard on yourself.
Yeah.
And just trust yourself and trust your instincts. You know the people that you can rely on. You know the people that'll give you good advice. Listen to them. Stop beating yourself up. Stop with the mom guilt. You can't be everything to everyone, and that's okay. Now, I say that now and can guarantee you that over tonight I'll be sitting at home going, God, I really need to reach out to that friend. I haven't. I'm an awful friend. You nearly can't help yourself sometimes. But I think as a person in my growth, I've developed an awful lot in that particular space. And I'm really grateful for that. And I'm really grateful that I have, because it's not living rent-free in my head as much as maybe it used to. People have to have confidence in themselves, trust themselves, reach out, talking to people. If that's an EAP counsellor, if it's a parent, if it's a spouse, if it's a friend, if it's a colleague, talking to somebody, I think just makes a huge difference to you, because other people have gone through. We're two women that have never met before today, and we have extremely similar thought processes and experiences, and our reactions have been quite similar. So just talking to people makes the world of difference.
I think that's fantastic. And look, thank you both so much for your generosity and sharing your stories. And hopefully this will help people that work as the carers in the HSE and work right throughout the HSE. So thank you very much. Okay, so as we wrap up this International Women's Day episode of the HSE Talking Health and Wellbeing podcast, I want to thank Una and Gillian for sharing their experiences so openly and honestly. To everyone listening across our health service, whether you're in the front line or in a supporting role or juggling caring at home as well as at work, we see you and we appreciate what you do every day. If today's conversation brought up anything for you, remember, you don't have to wait until you are in crisis to reach out for support. You can go and have a look at the Employee Assistance Programme and see if that's for you. It doesn't have to be work-related, as our guests have said. Go to our website. You can contact diversity.hr@hse.ie for support on diversity and gender topics in the workplace, and that will give you a list of different services that you can access. If you found this episode helpful, please share it with colleagues and friends or family. If you want to find more episodes of HSE Talking Health and Wellbeing, please go to any of the podcast platforms. Thank you for listening.